At around 11 p.m. on Saturday, the Minister of Health, Dr. Baryomunsi, made a surprise visit at Mbarara Regional Referral Hospital, but his discovery was terrifying. Dr. Baryomunsi started his facility tour at the intensive care unit, where he found only 2 medical interns attending to the emergency patients.
I think you should add where he found 2 medical interns that Baryomunsi doesn't want to pay. Yes, he's proposed that interns shouldn't be paid. So he found only 2 interns attending to patients whom he doesn't want to pay.
Dr. Baryomunsi went to the female medical wards. Here, this story was not any different. Caretakers decried congestion.
Look at this, ladies, and tell me if here diseases are not going to spread. You got all these beds that are full with patients, and then you have others sleeping on the floor. Come on!
Next to me, there is someone suffering from TB.
Oh my God. There's someone suffering from TB, but she doesn't have where to go because she's attending to somebody, her relative, a patient there. What are we doing?
You come here when you have a specific disease, but you may end up picking another one.
That's so heartbreaking.
Addressing the media, Baryomunsi said they are launching investigations in 2 operations of the facility.
There are patients who are charged money.
Ssaabaminisita atandikidde mu ddwaliro ly'e Mukono gy'asanze omujjuzo gw'abalwadde olw'obufunda bw'ekifo.
The place is too crowded.
Expensive. We left it and went to Mulago Hospital, and I can write a book about Mulago Hospital.
Yeah.
It's called a specialized hospital, but it comes
She's using air quotes, but
to a point. So I want to say that yes, we have that hospital there, but I think it's just a monument.
She is referring to Mulago National Referral Hospital.
You're watching Mordecai Marissa Live Political Commentary. Please consider subscribing to help grow Uganda's Voices of Struggle ecosystem. Thank you.
I cannot appreciate you enough for using your valuable time to always go on social media, break down things for people.
And yes, indeed, broadcasting to you from these United States of the Americas. Good morning, good afternoon, and good evening from wherever you're watching me and at whatever time you might enjoy these conversations. I am the aforementioned Mordecai Marissa, and you're welcome to Mordecai Marissa. You guessed that right. Live. Let's go. Are you ready, ladies and gentlemen? I guess you are. Let me sip some coffee. Here we go. Ladies and gentlemen, tonight again we expose the lies, the gaslighting of the Ugandan people, the PR stance of the Baryomunsi, the Minister of Health in Uganda. And again, point you at a problem we have called Museveni and Musevenism. There's no way Museveni can in any way fix these problems. The only solution we've got is to get rid of Museveni and Kainerugaba by extension. Look at this story. And probably before I actually play this story, I need to tell you about this. Ladies and gentlemen, Health Minister Dr. Baryomunsi was reportedly left stunned after making an abrupt visit to Mbarara Regional Referral Hospital. Underline, Regional Referral Hospital. Underline that, remember. When he went at this place or made this abrupt visit, he found patients sleeping on the floor, overcrowded wards, and sick Ugandans waiting for treatment under heartbreaking conditions. But here's what I do not really believe at all. I don't believe that Baryomunsi, the Minister of Health, was genuinely shocked. Absolutely not. There was no shock at all. How can a minister responsible for country's health sector be surprised by conditions that countless millions of Ugandans have been complaining about for decades? This is not a new crisis as they want to present it. It is a crisis that has unfolded in plain sight. And probably because Baryomunsi wants to show Hey, see, I am working. In fact, former Inspector General of Government, IGG Irene Mulyagonja, painted similarly a grim picture after the death of her husband at Mulago National Referral Hospital. Again, underline the term National Referral Hospital. She described Uganda's premier referral hospital as little more than a monument. She said it is just a monument, referring to a national referral hospital as just a mere monument. This is not Mordecai Murisa. If I said that, you'd be like, oh, Mordecai, we know you. You are just opposition. You oppose everything. No. This was a woman who was appointed and served Museveni, referring to the National Referral Hospital as just a mere monument. So when Chris Baryomunsi says he was shocked, many Ugandans are left to ask, shocked by what? Come on. This is the feature. It is the pattern of the Museveni criminal regime. The collapsing healthcare system has never been a secret. Patients have slept on the floors. Families have bought medicines that these are national referral hospitals do not have. Actually, they were recommended to go in private hospitals that are owned by the likes of Chris Baryomunsi. Doctors and nurses have worked under impossible conditions. Actually, just a few months ago, if not weeks, Chris Baryomunsi was propagating this idea of not paying interns. These are stories that have been told for years. And that's what we're going to be doing in this commentary, where I ask whether this healthcare minister, Chris Baryomunsi, his surprise reflects at all genuine surprise. It doesn't. Let me give the game away. Let me show you this story that was covered by NBS TV. Here it says, if you want to read with me, there it says, Health Minister Chris Baryomunsi was left in shock last night due to devastating conditions at Mbarara Regional Referral Hospital, where he made an abrupt visit. And I don't understand what's up with these abrupt visits. I will show you another one here by Nabanja, but let's go on and watch this story and laugh together. Come on.
At around 11 p.m. on Saturday, the Minister of Health, Dr. Chris Baryomunsi, made a surprise visit at Mbarara Regional Referral Hospital, but his discovery was terrifying. Dr. Baryomunsi started his facility tour at the intensive care unit, where he found only 2 medical interns attending to the emergency patients.
I think you should add where he found 2 medical interns that Chris Baryomunsi doesn't want to pay. Yes, he's proposed that interns shouldn't be paid. So he found only 2 interns attending to patients whom he doesn't want to pay.
While here, some caretakers narrated to him how they have spent days without being attended.
Look at that, ladies and gentlemen. This woman is sleeping on the floor. Do you know how cold that floor is? That's concrete.
In addition to being asked to buy their own medicines. Hours after interacting with some patients and pursuing their medical documents, Dr. Baryomunsi went to the female medical wards. Here, this story was not any different. Caretakers decried congestion.
Look at this, ladies, and tell me if here diseases are not going to spread. You got all these beds that are full with patients, and then you have others sleeping on the floor. Come on. Come on. Come on. This is Chris Baryomunsi pretending to care. They do not care. Like I've always told you, I had a friend of mine who sang that song. They don't really care about us. Yeah, friend of mine.
In the ward, extortion by the hospital workers and poor hygiene, which is threatening their health.
Yeah, it makes it worse. Oh my God. Everything is wrong with this country.
You look at the congestion here. What do you expect? Personally, I'm almost running away. Next to me, there is someone suffering from TB. So
oh my God. There's someone suffering from TB, but she doesn't have where to go because she's attending to somebody, her relative, a patient there. What are we doing?
you come here when you have a specific disease, but you may end up picking another one.
That's so heartbreaking. You come with a specific disease, but you might end up picking another one. That's so sad. That's heartbreaking. That highlights the healthcare in Uganda. Deterioration to the core.
They decried
Broken, not even deterioration.
lack of drugs, gloves, syringes, and some essential medical equipment.
Oh my
which
God.
They must
Look at them sleeping on the floor.
buy outside the hospital.
All of this can be fixed by one thing. It's called political will. Like I have argued here, ladies and gentlemen, I have told you, you have watched Caleb Akandwanaho, famously known as Salim Saleh, Museveni's young brother. He invites musicians, events organizers, and gives them billions of shillings. You've heard them when they argue, oh, so-and-so, actually, he took 700 million shillings. Oh, by the way, do you know Bajo received 550 million shillings? All for what? We witnessed Museveni awarding 5 billion shillings to Kasuku and the ilk, the social media content creators. For what? Now, hey, I don't have any problem if Museveni gives you money. Don't look at me and be like, hey, Mordecai, now you feel jealousy because you're not getting that money. I don't need money. I don't want that money. Zero. Not that I am rich, no, but just papers and coins. If Museveni is going to give 5 billion shillings to social media content creators, how about he surprises the Mbarara Regional Referral Hospital by fixing this? This mess can be fixed. Yes, it can. And fixing this mess doesn't actually take 5 billion shillings. It might take 1. How about you give the social media content creators 4 billion shillings and send 1 billion shillings to these people, at least to buy beds, to create enough room between these patients so that we do not end up in a situation where this woman said, you come with a specific disease and you pick one. You end up with TB. You come with, let's say what? Diabetes, you end up with TB.
At about
Look at him looking surprised. I'm going to have to show you here. Look at him looking surprised. Liar.
1 a.m., the visibly worried acting hospital director, Dr. Deus Twesije, arrived at the hospital and joined Baryomunsi as he continued to gather information about the facility.
Patient.
Now, this is going to come from somebody who wrote a book about optimism. Mordecai, what's wrong? If you want to go on and purchase a copy of my book now, probably this is the time to make an announcement. The Odyssey of the Optimist, a book by your own Mordecai Murisa, forward was written by none other than Joel Senyonyi, the leader of the opposition, whom Muhoozi Kainerugaba is fighting right now. That aside, while I wrote about optimism, I do not believe, call me a cynic, call me skeptical, call me a naysayer and a pessimist, but I do not believe that Chris Baryomunsi is going to do a thing. This is all for attention. This is attention performance. He's not going to do a thing.
It's disappear because they can't afford to buy medicine.
At the maternity ward,
Listen to this again.
gather information about the facility.
Patients disappear because they can't afford to buy medicine.
At the maternity ward,
Where do they disappear to? They go and commit suicide? Maybe.
Amtheire Rosette, the in-charge, told the minister that they lack delivery beds, midwives and essential drugs to handle the growing population of the mothers.
Because mothers are too many, you find when they supply us, by the time we are finishing a month or what, the drugs are done.
A few days ago, patients and caretakers protested poor health services at this hospital following the death of one of the patients when the health workers delayed to dispense her with blood. Patients incurred between 200,000.
Look at that. If that doesn't break your heart, now you know what's going on here. This man who has covered himself with a bedsheet is being taken or watched by probably his friend or a relative. And look at him. Look at him. They do not care. These Chris Baryomunsi, they don't.
To 250,000 to access X-ray, CT scan, and MRI services.
Oh my God.
Addressing the media, Baryomunsi said they are launching investigations in 2 operations of the facility.
There are patients who are charged money. Like one patient told me, She was asked to take an X-ray and asked 250,000 Uganda shillings. She could not raise the money, and for 6 days, the X-ray has not been done. When I speak to the authorities, they say no, an X-ray in Mbarara Hospital is free.
Baryomunsi also discovered...
Yeah, that's the country. That's the kind of presidency you've pushed for years, the Museveni presidency. That is the culture. Yeah, where people are being charged huge sums of money to meet Museveni because they know meeting Museveni means Museveni giving you money, taxpayers' money for free. Actually, I heard somebody say that, hey, when you meet Museveni, the only question he asks you is, what do you want? Do you want a house? Do you want to go study abroad? Do you want money? Or do you want to be appointed RDC minister or what? What do you want? It's not about fixing complaints you've been raising. Absolutely not. It is how do I gag you?
In the security of the hospital, which he asked the administration to address. The acting hospital director, Dr. Deus Twezije, acknowledged some of the issues at the facility, but he largely blamed them to overcrowding of patients.
What? What? Are you blaming patients? Listen to this again.
Some of the issue director, Dr. Deus Twezije, acknowledged some of the issues at the facility, but he largely blamed them to overcrowding of patients.
No! It is failure to be funded, to be taken care of by the government. You cannot blame patients. Patients become overcrowded in that place because that's the place they have to come to. If the government is not going to construct any other health center, you don't blame. What's wrong with this man? What?
Every patient that comes here doesn't expect to be admitted on a floor. It is happening. A patient who comes here doesn't expect to wait for theater services for 2 days.
If he's going to blaming patients, where should they go? Okay, now, like I told you, ladies and gentlemen, this is not happening for the first time. And I'm going to play you here, Irene Mulyagonja. This is Nabanja. Again, PR stance. Oh, Nabanja is making abrupt visit.
Enkyaleero Ssaabaminisita wa Uganda Robina Nabbanja abitaddemu engatto n'ayolekera mu disitulikiti y'e Mukono ne Kayunga okuzuula oba nga munnamawulire byategeezezza omukulembeze w'eggwanga bituufu bwe yabadde yakamala okwewandiisa n'akakiiko k'ebyokulonda okuddamu okuvuganya ku bwa pulezidenti. Ssaabaminisita atandikidde mu ddwaliro ly'e Mukono gy'asanze omujjuzo gw'abalwadde olw'obufunda bw'ekifo.
The turn-up of patients at that hospital shows that those doctors who are working there are giving a service.
So, what does this actually tell you? That, you know what? The shock of Chris Baryomunsi is utter nonsense. East or west, north and south, central. This is the feature of the health care system in Uganda. We've been looking at what is going on in Mbarara, or Mbarara as we want to call it, Banyankore, and then now we go to Mukono. It's the same crisis.
Otherwise, they wouldn't come. The place is too crowded to the extent that we had nowhere even to pass. The pregnant mothers, those who are in the queue to deliver, it's busier than here. But of course, we appreciate that this is a regional hospital. You only get referrals.
Kyokka Ssaabaminisita anenyezza abakulembeze mu kitundu kino olw'okusirika obusirisi ne batategeeza gavumenti ku kusoomooza kuno.
When we tell you please elect members of parliament who can connect easily with government, this is what we mean.
You're stupid. You're stupid. Now he's blaming voters or constituents. Nabanja, you're stupid. I'm sorry. That's a stupid idea. Or see, you have all these problems because you're electing people who oppose the Museveni criminal regime. What? Oh, when we tell you to elect members of parliament, elect those who can directly get to Museveni. No, that's not how a democracy should function. And services should be provided to all Ugandans without even putting in consideration their political identities. I should be treated like I've said, we are all stakeholders in a company called Uganda. You cannot claim it more than myself. We all have equal shares. Now he's blaming these people.
I believe the press has seen the difference between Mukono, which is a municipality, and Kayunga, which is a town council.
Municipality, let's leave that lady. But you saw. Okay. I think I need to take you now to Irene Mulyagonja. She pointed this out. This was Irene Mulyagonja shortly after the passing of her husband. Listen.
I have a story that I can tell about what I called our hospital tourism, because we started in IHK, then we went to Zambia 2 times, then we went to Mulago, then we ended up in IHK, in Mukwaya General. That is over a period of only 2 months. And why did we move from hospital to hospital? We started at IHK. The costs was insurmountable. I, on my own, could not bear them.
Imagine, this is IGG speaking. Former Inspector General of Government saying, hey, the costs were insurmountable. Then how about the ordinary Mordecai Morisa, who has never held any position in government, who survives on $1 a day? There are so many Ugandans who actually don't even earn $1. That's 3,600 shillings.
And I could not start, I am a judge of the Court of Appeal, the Constitutional Court. I could not start going to ask for money to look after my husband.
That's egotistical.
I had to find a way of looking after it. So we kept on going lower. We left that hospital. We went to Zambia Hospital. It had also become, I thought Zambia was a place where we could find refuge. It had also become more expensive. We left it and went to Mulago Hospital. And I can write a book about Mulago Hospital.
Yeah.
It's called a specialized hospital. But it comes...
She's using air quotes, but...
to a point, and this speaks to health care in this country. Let him who has ears hear. If on 6B, the private wing in Mulago Hospital, the government of Uganda can fail to provide you with a shot of insulin, and on the same 6B, you can fail to find an NG tube. You know an NG tube? These tubes they use to feed people. At the end of his life, Mr. Kaskoza failed to eat. But you can come to a day where they tell you, oh, we are going to put an NG tube. Someone comes in the morning and says, oh, we'll put an NG tube. It disappears. The next person comes on duty and says, oh, we are going to put an NG tube, and he disappears. Then finally in the evening, someone comes and says, you know what? We don't have Mulago National Specialized Hospital.
Yep.
And I have to say this, John would not forgive me if I didn't say it, because he fought for the rights of others. I too have fought for the rights of others. It's my passion to fight for the rights of those who are vulnerable and cannot provide for themselves. So I want to say that yes, we have that hospital there, but I think it's just a monument.
But I think it's just a monument. She is referring to Mulago National Referral Hospital. What does referral mean? When all hospitals and health centers have failed, they refer you to the best national, our premier referral hospital. And former IGG is telling you, you know what? That is just a monument. It means nothing. That is Uganda for you, ladies and gentlemen. Don't be lied by this stance of Baryomunsi. Oh, abrupt visit. They mean totally nothing. They mean totally nothing. Nothing is going to change. Nothing. The problem is called Museveni and Musevenism as a culture. Yes, we have a problem called misplaced priorities. That's why you see, later on I'll play you a video here. I'm going to make commentary about Frank Walusi. Frank Gashumba. Walusimbi is a very wonderful gentleman. But Frank Gashumba. They will tell you that the only way of fixing a problem is by creating one. That's where he was complaining about, all institutions are dead in Uganda. Then roll the clip. A few months back, he was campaigning for the man who has presided over the death of institutions. So, Chris Baryomunsi, there's nothing you're gonna do. I am sorry to be the bearer of the bad news, but this is where we are. Until we get rid of the Museveni criminal regime that have no iota, not a scintilla of interest of changing the lives of Ugandan people, nothing's gonna change. Zero. Take a look at the crackdown on corruption and illicit enrichment by Muhoozi Kainerugaba. Oh, let's target Anita Among, but we spare Thomas Tayebwa. Make it make sense. Or we spare Adolf Mwesige. Anita Among because she's a, do they call them Iteso? I don't know. I'm a Munyankore. So because she's a Muteso, probably that's what I should say. She was enriching herself illicitly and stealing from national coffers with Tayebwa. But Mo says, let's protect Tayebwa, let's arrest Anita Among. Okay, my name is Mordecai Iburi, so I'm going to have to stop here because it pisses me off. Now, you know what you do, folks? Make sure that you like, comment on this video, subscribe, and become a channel member. You can just hit that join button, and then you'll be able to pay me for this wonderful job. Now I'm blowing my own trumpet. Every month. Okay, I'll talk to you soon. Have yourself a wonderful time.